You know how some words are just like thrown around so much that they lose all meaning?
Totally.
We're tackling one of those today, and that's nano.
Right.
You've heard of nanotech, obviously.
Of course, yeah.
But here's the thing. A nanometer is 1 billionth of a meter.
Wow.
It's like comparing a marble to the entire Earth.
That's tiny.
That's the scale we're talking about when we dive into the world of nanorobotics. And to guide us through this very intricate world, we're using excerpts from the Wikipedia article on nanorobotics.
Okay.
It's, comprehensive enough to give us a solid understanding of this complex field.
And a really great starting point to really grasp the fundamentals of nanorobotics and then explore its, mind-blowing potential, especially in medicine.
Yeah, for sure.
Yeah.
Okay, so let's unpack this a little bit.
Okay.
What exactly are nanorobots? I mean, are we talking about microscopic robots smaller than a human cell?
Well, the definition is kind of surprisingly complex.
Okay.
The term nanorobot can refer to devices that are built with components that are just a few nanometers in size.
Wow.
So true molecular machines.
Okay.
But we're still largely in the theoretical realm with that.
Right.
And then there's this idea that even larger devices, if they can manipulate matter at the nanoscale, can be considered nanorobots.
So something like, I don't know, an atomic force microscope.
Exactly.
Which isn't nano in size.
Right.
Could still be considered a nanorobot in this context?
Exactly. It's about the level of precision and the ability to, interact with the world at the nanoscale, rather than just its physical size.
Fascinating. This concept of manipulating matter at such a minute level, it's like something out of science fiction.
Yeah. It does seem like something out of Star Trek, right?
Right.
But the idea of nanorobotics, particularly in medicine, has actually been around for decades.
Really?
Yeah.
Where did this whole concept originate?
It can be traced back to a 1959 talk by physicist Richard Feynman.
Okay.
It was titled, "There's Plenty of Room at the Bottom."
Plenty of room at the bottom. Okay.
He proposed this, revolutionary idea of swallowing the surgeon. Essentially, tiny machines small enough to travel through your bloodstream and repair things at a cellular level.
That's incredible. Talk about a forward-thinking vision. But how do you even begin to build something that small? I mean, the engineering challenges must be, mind-boggling.
You're right. The manufacturing process is incredibly complex. There are numerous approaches being explored, building nanorobots on biochips, using DNA as building blocks, even utilizing bacteria as, tiny biological robots.
Hold on, bacteria as robots. How does that even work?
It's a fascinating area of research called biohybrid robotics.
Okay.
It involves combining biological and synthetic elements.
Okay.
Take bacteria like E. coli.
Okay.
They have these whip-like tails called flagella,
Yeah.
which they use for movement. And scientists are learning to control that movement using external stimuli like magnetic fields.
So they can essentially, steer the bacteria.
Yeah, exactly.
That's amazing. What are some other promising approaches to building these nanobots?
One that's particularly intriguing is 3D printing at the nanoscale.
Wow.
You're essentially building objects atom by atom,
Oh, wow.
which requires incredible precision. One method that they're looking at involves a two-step process. First, the intricate details of the nanorobot are etched onto plates using lasers. These plates are then used with a 3D printer to build the nanorobot structure layer by layer, using nanoparticles as ink.
Wow.
Imagine constructing a house brick by brick, but on a scale 1,000,000 times smaller.
It's like science fiction becoming reality right in front of our eyes. And with these biohybrid and 3D printing methods, what kind of nanorobots are scientists creating? What do they actually look like?
Well, they are exploring various designs, but one that has shown real promise is the magnetic helical nanorobot.
Helical, so spiral shape.
Exactly.
Why that particular design?
Well, the helical shape, much like the tail of a sperm cell or those bacterial flagella we talked about, is incredibly efficient for movement at the nanoscale.
Yeah.
They convert rotational motion into translational movement.
Right.
The magnetic part is key, too, because it means we can control their movement externally using magnetic fields, like tiny remote-controlled submarines, but navigating your body.
That's incredible. It sounds like there's a lot of inspiration being drawn from nature itself.
Absolutely, yeah.
But how do they actually work? I mean, the mechanics of something that small must be incredibly complex.
Imagine these helical nanorobots spinning like tiny corkscrews,
Okay.
propelling themselves through fluids. The equations governing their movement are fascinating. Essentially, their size directly influences their speed, and a larger magnetic component means faster movement, We're talking about precise control at the molecular level.
I can only imagine the level of engineering and scientific understanding required for that, but it's also theoretical.
Yeah.
What are some concrete examples of how these nanorobots could be used in medicine? What kind of impact are we talking about? Give me some specifics. Like, how would these nanobots actually be used to, like, treat diseases?
Okay, let's take cancer treatment as an example.
Okay.
So right now, chemotherapy floods the entire body with really powerful drugs,
Right.
which causes significant side effects, as you know.
Right, of course.
With nanorobots, we could deliver a precise dose of the drug directly to the cancer cells, minimizing harm to the healthy tissue.
Wow.
So that's targeted drug delivery in action.
Okay, so targeted drug delivery sounds like a revolution in itself.
Yeah.
But what other medical applications are we looking at with this?
Well, the possibilities are almost limitless. We could use nanorobots for targeted cell delivery.
Okay.
Imagine repairing damaged tissue at the cellular level.
Wow.
They can even be used in incredibly delicate procedures.
Okay.
For instance, the article mentions using them to capture and transport sperm cells,
Really?
which could potentially offer a breakthrough in male infertility treatment.
Now, that's what I call precision medicine. Using nanobots to, like, transport sperm cells, it's just mind-blowing. What other applications are researchers really, really excited about?
Tissue regeneration is a big one.
Okay.
Imagine using nanorobots to, stimulate the body's natural healing process,
Okay.
repairing wounds, and even damaged organs with incredible precision. It could really revolutionize how we approach surgery and recovery.
It's like having a team of, like, microscopic surgeons working on you around the clock. It sounds too futuristic to be real.
But you mentioned earlier that research is already underway.
Yeah.
What kind of progress have scientists made in, actually testing these applications?
Well, it's still early stages.
Sure.
But some breakthroughs have been truly remarkable. The article highlights a study where a chitosan-based helical swimmer, so essentially a nanorobot,
Right.
successfully delivered an anti-cancer drug in a really controlled manner.
Wow.
This demonstrates the potential of targeted drug delivery, and it's just the tip of the iceberg. So they're already delivering drugs with nanorobots in, like, controlled settings.
Right.
That's incredible.
That's really cool.
It is really cool. But, we've talked a lot about the potential benefits.
Yeah.
What about the challenges? What obstacles are researchers facing in, like, developing and implementing nanorobotics?
Well, it's important to acknowledge the challenges.
Right.
Designing and manipulating objects at the nanoscale is incredibly complex.
Right.
One of the biggest hurdles is the need for extremely precise tools. We're talking about interacting with and manipulating individual molecules,
Wow.
which requires an unprecedented level of precision.
I can only imagine. It's like you're talking about needing steady hands to perform surgery, but a million times more difficult.
Oh, absolutely, yeah.
Are there other challenges beyond just the tools themselves?
Oh, absolutely.
Okay.
The physics of working at the nanoscale is completely different.
Okay.
Adhesion and friction, forces we barely even notice at the macro level, become significant design considerations.
Well,
At the nanoscale, think of it this way. If you tried to build a car out of magnets,
right.
everything would just want to stick together.
Right. Yeah.
The same principle applies to nanorobots.
Okay.
Scientists have to design these machines with minimal contact areas to prevent them from getting stuck or clumping together.
So it's not just about shrinking down existing robots. It's a whole new world of engineering with its own unique set of rules.
Exactly.
Wow.
And then there's the challenge of biocompatibility.
Right. Of course.
These nanorobots are going to be operating inside the human body.
Yeah.
So they need to be made of materials that won't trigger immune responses or cause harm to cells and tissues. We need to make sure they're not just effective, but also safe for long-term use.
That makes perfect sense. It's like trying to design a submarine that can, like, blend seamlessly with the ocean environment.
Exactly.
Given all these hurdles, what's the current state of nanorobotics? Are we anywhere close to having these tiny surgeons, swimming around in our bodies?
Well, we're still in the early stages, but honestly, the progress made in such a short period is pretty astonishing.
Yeah.
As of 2016, the FDA regulates nanotechnology based on size, which gives you an idea of the stage we're at. However, the potential applications in medicine extend far beyond what we've even discussed so far.
Really? So this is just the beginning.
Yeah, pretty much.
What other, like, exciting possibilities are kind of on the horizon?
Well, the article mentions early cancer detection as a major area of interest. Imagine nanorobots patrolling your bloodstream, identifying and potentially even neutralizing cancerous cells before they can even form tumors. That's the future we're talking about.
That would be a complete paradigm shift in cancer treatment and prevention. What other revolutionary applications are scientists, like, exploring?
We're also looking at advanced surgical tools. Imagine using nanorobots to perform minimally invasive surgeries, guiding them with incredible precision to repair damaged tissues with, like, minimal scarring.
Wow.
It could revolutionize fields like neurosurgery and ophthalmology.
It's like having a, microscopic toolkit for the human body.
Right.
The possibilities are truly mind-blowing. But it's not just about treatment and surgery, is it?
Right.
What about monitoring and managing chronic conditions?
Well, that's another really exciting frontier. The article discusses using nanorobots as tiny monitoring systems for diseases like diabetes.
Okay.
Imagine having nanobots constantly monitoring your blood sugar levels.
Right.
And releasing insulin only when needed,
Wow.
eliminating the need for painful finger pricks and insulin injections.
It's like having a 247 medical team inside your body, constantly, monitoring and adjusting things to keep you healthy.
Precisely.
Wow.
And it's not just about diabetes. We could use nanorobots to monitor a wide range of biomarkers, providing real-time feedback on everything from, like, your heart health to your immune system function. It could really personalize healthcare in ways we can only dream of right now.
It's truly incredible to think about. We've talked about these tiny robots.
Yes.
But the article also mentions something called MRI-guided nanocapsules.
Yes.
What are those, and how do they kind of fit into the picture?
So MRI-guided nanocapsules are like a stepping stone towards fully functional nanorobots.
Okay.
They're essentially tiny capsules that can be filled with drugs or other therapeutic agents and guided to specific locations in the body using MRI technology.
So they're not quite robots,
Right.
but they utilize similar principles of targeted delivery and external control.
Exactly. And while they may not be as sophisticated as fully autonomous nanorobots, they still represent a crucial step towards realizing the full potential of nanomedicine.
So we have these tiny submarines and now these guided capsules all operating at the nanoscale. It's incredible how quickly this field is, evolving.
I know, it's really exciting.
It is exciting. But with all this talk about scientific advancements, we can't ignore the cultural impact, can we? I mean, nanorobots have really captured our imaginations well beyond the lab.
Oh, absolutely, yeah. Nanorobots have been a staple of science fiction for decades, appearing in books, movies, TV shows, from Star Trek to Mystery Science Theater 3000.
Right.
These microscopic machines have both fascinated and terrified us with their potential.
It's interesting that you mentioned both fascination and fear, because there's this underlying concern about self-replicating nanobots, right? The whole gray goo scenario.
Right, right.
Is that a valid concern, or is it just science fiction hype?
The gray goo scenario, where self-replicating nanobots basically consume everything in their path, is a popular theme in science fiction. And, it's a valid concern to, think about. But most experts agree that it's highly unlikely. However, it does highlight the importance of careful design and ethical considerations when working with such a powerful technology.
But with any powerful tool, right, there's always the potential for misuse or unintended consequences.
Yeah.
But focusing on the positive for a moment, what are some of the most exciting future implications of nanorobotics? What kind of world could this technology create?
I mean, it's truly inspiring to think about. Imagine a world where diseases like cancer and Alzheimer's are eradicated,
Wow.
where genetic disorders are corrected at the source, and where aging itself is no longer seen as inevitable.
It really is. It's both exciting and a little daunting, honestly, to think about the implications. We're talking about potentially reshaping our entire understanding of health, disease, and even the human lifespan.
Oh, absolutely. It's a paradigm shift.
Yeah.
And like any major technological leap, it comes with a responsibility to really consider the ethical implications.
For sure. And, we're not just talking about the potential for misuse,
Yeah.
but also the broader societal impact, you know? How will these advancements affect our access to healthcare, our privacy, even our sense of identity?
Exactly. And those are questions we really need to be grappling with, now, not after the technology arrives.
Right.
For instance, if we can use nanorobots to enhance our bodies and minds, will those enhancements be available to everyone, or will they further widen the gap between, the haves and the have-nots?
That's a really, really critical point. And what about, the ethical considerations surrounding the technology itself? We've talked about self-replication,
Right.
but what about like the potential for nanorobots to be used for surveillance? Or even to like control people's thoughts and actions. I mean, it sounds like science fiction, but is it entirely out of the realm of possibility?
I think it's really important to have these conversations, even if they seem far-fetched at this point.
Right.
The potential of nanorobotics is vast. And with that potential comes a responsibility to make sure it's used ethically and for the benefit of all humankind.
Absolutely. It's a lot to consider. But ultimately, it's about harnessing the power of this technology for good. Imagine a future where nanorobots are helping us like clean up the environment, create sustainable energy sources, even, explore the far reaches of space.
Right, possibilities that really capture the imagination.
Yeah.
It highlights how nanorobotics isn't just about medicine. It has the potential to revolutionize like countless aspects of our lives.
It's a future worth striving for, honestly. So for our listeners out there, hopefully this deep dive has given you a glimpse into this incredible world of nanorobotics.
Yeah,
Its potential to revolutionize medicine, redefine our understanding of what's possible, and maybe even like reshape the future of humanity.
absolutely.
But it's not just about the science, it's also about the choices that we make as a society, about how we develop and utilize this very, very powerful technology.
It's a future we're all shaping together. And the advancements in nanorobotics are moving at an incredible pace. So staying informed and, engaged in the conversation is more important than ever.
Couldn't agree more. Knowledge is power. And the more we understand about these emerging technologies, the better equipped we'll be to kind of like navigate the exciting and, challenging future that they hold. Thanks for joining us on this incredible journey into the world of nanorobotics. Until next time, keep exploring, keep questioning, and most importantly, keep learning.